Thank you for inviting me to be part of this meeting. And really, I should start by thanking all of you on the call for the help that you provide the poorest of the poor in the countries that Food for the Poor serves. As we say all the time, we don't get to do anything without the generosity of the donors that support us. And it's always extraordinary to me how long many donors have been with us. They have, really committed their philanthropy to Food for the Poor in so many ways. And so again, we call upon that generosity because there is going to be just a huge need. I think none of us have a crystal ball. We cannot anticipate exactly what is going to happen. So this level of uncertainty with respect to what is likely in these countries that we serve can only really be addressed by witnessing what we've seen in the US. I mean, I think unprecedented becomes an inadequate word to describe, 26 million people losing their jobs. And, I think the death toll here in the US is getting close to 100,000 and so many people infected with the virus. And I think that to me is the frame of reference that says to me, how is this possible? How could this happen to us? And we have so many resources available to us, whether it's healthcare, whether it's, the power of the resources that come from money and ability to organize. Now we need to transfer that paradigm to what is really going on already in the countries we serve. So, and I think I was reading an article that the BBC News Service put out. Let's see what date it was, 21st of April, last week. And the headline is World Risks Biblical, quote unquote, Biblical Famines Due to Pandemic. And the article then goes on to talk about the 10 countries in the world that have the greatest risk. And 2 of them are countries in our hemisphere. One is Haiti, and the other one is Venezuela. These are the 2 at the greatest risk. But I can tell you already, without a BBC News article, we know from all of these countries, whether it's Guatemala, it's Honduras, Jamaica, El Salvador, these countries have already told us how much they're hurting. So what is happening? Well, for some countries, let's take Jamaica, because that's an easy one for us to get our heads around, because so many of us are familiar with Jamaica. But the whole hotel and tourist industry just stopped. There is no one going in to these resorts. They're all closed. So you can imagine for countries such as Jamaica, where their economy is based on such a large percentage of the tourism industry, that money just shuts off. And so those people forget the virus. The economic pain is already being felt. So literally tens of thousands of people are seeking food that weren't seeking food, a few days ago. And this is before the damage is done with the virus. So you heard Bishop talk about the 74 cases in Haiti and 6 deaths. I think in Jamaica, it's 105 cases and sort of, handful of deaths as well. But this is just the beginning. There's a lag time for all of these countries as the virus is starting to sort of go on shore, as it were. And we've seen what's happened here. The countries that we're talking about and that we serve are not equipped. They do not have the medical resources, whether it's the hospitals, it's the clinics, it's the tools, the resources, the respirators, whatever it is, they just don't have it. So what's going to happen? Even a casual observation of most of these countries, you see it's like having the streets of New York writ over many, many times, right? The density of populations in these urban areas is extraordinary. So how do you practice social distancing when there's literally thousands of people, in close proximity within an hour, And so we do fear for these countries, and so our approach really has been so far to really listen to what the need is, and there's only really 2 things that are being asked for. One is food, and the other is the medical supplies, medicines, and respirators, of course, which are in such short supply. So we have already been able to ship out a number of containers. I think we sent out about 114 containers since mid-March, and a lot of them had what we could put our hands on, whether it was masks and respirators, but a lot of it was the food that was being asked for. And that's going into all of these countries. I don't know that you would know just the scale of how many containers we send each year, but it varies depending on the programming and so forth. But it's really anywhere between 3,500 and 4,500 containers are going to these 17 countries every year, and a huge percentage of it is food. So we've sent quite a bit already. We're actually now purchasing 52 more containers worth of food. So these are all filled up, and we're spent to do that. We're actually just 10 days ago, I authorized spending $1 million on food to get it so that it could start to be shipped. The need is so great that we actually kicked off a $10 million campaign for food for the rest of this year, over and above what we normally do. And that's the piece and the message I think I have to share, is that on a good day, it's difficult in these countries, with respect to the number of people who need help. But on the bad day, that is the crisis of coronavirus and COVID-19, the challenge is going to be literally unthinkable. And so what we talk about today is only the tip of the iceberg. I don't really want to know what it's going to look like in 2 months, from the statistics. It'll be horrifying. What I do know is that we have to get the engine going to make sure that we're delivering as much food and as much medicine and medical supplies as we can get our hands on. But they're all critically needed. So we're doing our best, and we are doing a lot. We've had to learn how to work from home like everybody else. So, but the gifts in kind people and the purchasing people are all working, literally around the clock, trying to get these containers lined up to get food out. We are very, very concerned. We do have the experience of really terrible situations in the past, whether it's, in fact, the earthquake in Haiti is a good example, and 10 years ago. We know what it's like to respond to, sort of the emergencies that happen because of natural disasters. This one is a whole different thing, because we really don't know how many people are going to get impacted by this. And even just the ability not to be able to work is catastrophic, right? It's one thing to have, to see the fatalities, and those are going to be horrible numbers to look at. But imagine the people who are suffering because they're going to have to spend 30 days struggling with the illness, the symptoms of the illness, whether it's the fevers and it's all of the terrible things that go on with it. They can't work. Their family doesn't get to eat. It's that we have to put ourselves in mind of. And I really do think this is one of those things where, as it gets further down the road, our appeals will get more kind of desperate, meaning that we'll be able to quantify exactly what we're responding to. Right now, this is the anticipation of a deep crisis that's going to probably be with those countries, for 6 to 9 months, after we, in the immediate to midterm future here. So I'll end my comments there. We can pick up any specific questions in the Q&A, but I just want to, again, end as I began, thanking everybody for everything that's being done, because it all matters, it all counts, and we just so deeply appreciate how much everyone cares for our neighbors.